It's 12 o'clock. We're going to go ahead and get started. I'm going to go ahead and pass it over to Dr. Urbina.
Thank you, Mora. Hi, I am Dr. Jessica Urbina, and I am presenting this web series, the ECHO, Project ECHO, Safer Clean during COVID-19. Now, I'll go ahead and give a brief introduction and background to catch everybody, and then I'll go ahead and pass it over to our speaker, Mary Kate. So this is just directing you onto the PASU National Classroom, where you can find many resources, webinars, online courses, and a resource catalog. Many offer continuing education credit. So log on there if you're interested in additional information on pediatric environmental health safety. And also, dissemination purposes, to have this as enduring material, we will be recording the presentation part of the series. However, the discussion session, the case presentation or scenario presentation will not be recorded, so you can feel free to speak up and share anything that you would like to have discussed. Of course, if you have any questions or concerns, just go ahead and email me or send me a chat. Now, who are we? We are the PASU Region 6, so that's the Pediatric Environmental Health Specialty Unit, also known as the Southwest Center for Pediatric Environmental Health. Now, Region 6 does encompass Arkansas, Louisiana, Oklahoma, Texas, and New Mexico. All 5 states are represented. And we have funding from the American Academy of Pediatrics, the EPA, the Centers for Disease Control, and the Agency for Toxic Substances and Disease Registry. Now, all of funding goes, we did get a supplemental grant to disseminate information about the pediatric risks from chemicals in cleaning, disinfecting, and sanitizing agents, and all the recommendations you'll see here according to the CDC and the American Academy of Pediatrics. Goals of our region, our PASU, is to reduce mental health risks and threats to children. We wish to expand access to pediatric environmental medicine expertise, to strengthen the pediatric environmental medicine and the public health prevention capacity through education and expanded collaborative relationships. And that's where you all, connecting to the community, health worker leaders, so that we can together disseminate the information that is crucial during this time. And also the goal is to deliver relevant education and consultations for pediatric patients, their families, and the healthcare providers to address the environmental health risks to children. So projects are our Project ECHO, which is what we're doing these sessions. So this is for safer clean during COVID-19, and our hopes are to get the word out on some of these dangers to the pediatric population from some of the ingredients in cleaners, sanitizers, and disinfectants. And coming up, we have a Train the Trainer, and that is where we are developing a flip book, and that will go out to with the community healthcare workers, and we train the trainer, community healthcare workers, so that they can disseminate that information to the members in their communities. So keep an eye out on your inbox for that. We'll have that out in the next few weeks, or the end for that, participating in that in the next few weeks. Now, coming up next, just wanted to remind you that we do have 4 more sessions after this. Coming next is a presentation from Dr. Susan Buchanan, and that's on the COVID-19 vaccines. You can go ahead, screenshot that, click a QR code, and register for that if you haven't already. And after that, we have 3 additional that'll be cleaning, disinfecting, and sanitizing in the home, presented by myself. And then Dr. Sarah Watkins will talk about the conference in the home from household chemical dangers. And EPA Safer Choice Alternatives by Dr. Salva Essa will be following in September. Now, some quick helpful tips. If mute your microphone, go ahead and mute your microphone during the presentation, and then unmute after the presentation. You can unmute yourself if you want to ask a question or participate in the discussion. So any questions that you have can be added to the Q&A or the chat, or you can also speak up during the discussion. It makes much more interactive session. If you have any IT issues, please contact myself. Here's my phone number, the email, or you can send me a chat directly through the. Now, briefly, what is an ECHO? This is the Extension for Community Healthcare Outcomes. It's a free, innovative telehealth / teleeducation outreach model, and it's connecting the community members to a multidisciplinary team of environmental health toxicology specialists and in pediatric health and toxicology. And so we can go ahead and resolutions to many of the things that are coming up in the community, especially when it comes to COVID-19 and a lot of disinfecting practices. It's creating the partnerships. It's an important tool for the experts to find out what's going on in the community and for the community members to have the feedback from experts in effective concerns. It also promotes case or scenario-based learning. So by attending these sessions, you yourselves are learning how to, address these issues that come up by being informed and having really science-backed evidence and guidance on how to resolve these issues that will come up. So a brief anatomy of the ECHO. Now we've gone through our welcome and housekeeping. I've introduced our speaker, I'll introduce our speaker, Mary Kate, and her background, and then she'll go ahead and go on into our lecture section. After the lecture, we will stop the recording and open it up to case and scenario presentation. And that's where we get questions from the community on, this is going on. A community member will bring up an issue that's come up, and then we can discuss it with our experts and with myself and come up with some solutions on how to handle some of those things that come up. And then at the close, we'll go ahead and remind everybody, what's coming up next, and to please fill out your surveys. Now, I'll go ahead, Mary Kate, I'll go ahead and relinquish share control of the screen. And I'd like to introduce Mary Kate. She has so graciously agreed to give our ECHO session. She's a health consultant for the Northwest Pediatric Environmental Health Specialty Unit. And she's completed her Bachelor of Science in Nursing degree at Boston College. And currently she's at the University of Washington in the Doctor of Nursing Practice program, working toward becoming a pediatric primary care nurse practitioner. Her work with the Northwest PACU includes researching and responding to pediatric environmental health inquiries and finding ways to translate that into understandable, actionable material for community members and other healthcare professionals. We're very excited to have her great presentation. I'll go ahead and hand it over to you, Mary Kate. Thank you.
Thank you, Jessica. Can you hear me okay? Yes.
Yes, we can hear
Okay.
you just fine.
Great. Thank you. Okay, so this is session 2, and today I'll be talking about COVID-19 and environmental vulnerability in children. Again, my name is Mary Kate. I'm from the Northwest PACU, so we cover Washington, Alaska, Oregon, and Idaho, and we're based out of the University of Washington. So these are just my acknowledgements and disclosures, thanking the AAP, CDC, ATSDR, and the EPA for funding used for this project. So for learning objectives today, my hope is that by the end of the presentation, participants will be able to understand children's unique vulnerabilities to environmental hazards, understand how COVID-19 may affect children and adolescents, and be able to refer to evidence-based reproductive and pediatric environmental health resources. So what is children's environmental health? I've got 2 quotes in here that I thought encompass it really well. So Phil Landrigan was one of the fathers of children's environmental health, or is one of the fathers. And he is quoted saying that it's the prevention of illness and death due to preconception, prenatal, childhood, and adolescent exposures to environmental hazards. And then from the Children's Environmental Health Network, they describe it as environmental health issues encompass the built environment, the biological environment, and the chemical environment to which we and our children are exposed. So it's really just extending the definition of health to incorporate the child's environment and underscoring the broad range of potential impacts that these exposures are having on children. So I asked Region 6 what some of their most common PASU consult topics are. So we get consults from community members and healthcare providers and parents. And so these are a few of their most common consult topics: natural gas, carbon monoxide, household cleaners, which you'll be hearing more about from Jessica in her presentation on safer cleaning and disinfecting for COVID-19. Pesticides, mold, and drugs of abuse. And so this aligns with some of the consults we get in our region as well, but we also get a lot of consults about lead exposure and poisoning and wildfire smoke, as you can imagine, in our region. So as you can see and imagine, environmental health encompasses a lot of different topics. So if there's any big takeaway that I want you to go home with today, it's that children are not small adults. They have unique activity patterns and behaviors. They have physiological differences. There are certain windows of susceptibility, especially during early life stages. They are dependent upon adults to ensure a safe environment, so they don't have control or as much control. And then whatever exposures that do occur can have lifelong consequences and might not be noticeable right away. So there's the potential for longer durations of exposure and latency of symptoms and certain health effects. So let's talk a little bit more about a few of the things I just mentioned. So for unique activity patterns and behaviors, what does that mean? So children are often consuming more dust, dirt, and non-food items through normal neurodevelopmental behaviors, neurotypical behaviors like hand-to-mouth behavior. They're mouthing toys, they're mouthing everything. So they have that route of exposure. There are also other unique routes and pathways of exposure, such as transplacental and via human milk. They are also hopefully spending more time outdoors and near the ground, so there's the potential to be exposed to certain things there as well. There are physiological differences as well, so they breathe more air, drink more water, and eat more food relative to their body mass. So what this means is that they are getting a higher dose of whatever they're breathing in, eating, drinking, than an adult may in the same situation. Their diet is also typically more restricted, especially in toddlerhood. There's lots of picky eating behavior. So if an exposure source is coming from a certain food, and that certain food happens to be something that they love and their diet is otherwise restricted, they could be getting a larger dose of exposure for a larger duration. They also have immature natural defense mechanisms, so they may not mount an effective immune response. They have a more permeable blood-brain barrier. Their nasal passages are less effective at filtering things that they're breathing in, and they have more permeable skin. So more permeable skin plus a larger relative skin surface relative to their body mass. If we remember, the skin is our largest organ. It's our first line of defense against a lot of exposures. And so when our skin is more permeable and we have a higher relative surface area, then there's a higher chance and more effective absorption when children are exposed to things dermally or on the skin. There are also differences in their ability to process and eliminate toxicants. So they still have developing organs, there are certain organs that are responsible for metabolizing and excreting toxicants that are not fully developed and therefore not as effective at processing and eliminating these toxicants. There are also windows of susceptibility. So these are critical windows of development for certain organ systems that may be affected or disrupted if an exposure occurs. So the timing of the exposure is critical in determining the consequences. So for example, if there is an exposure during pregnancy, there's going to be different health effects if you're exposed, if the child in utero is exposed during the first trimester versus the third trimester, because different structures are developing at different points throughout pregnancy. And again, these exposures can have lifelong consequences. And the same dose of something during one phase of development, again, could have drastically different consequences. So I'm going to transition and talk a little more about COVID now in relation to child health, now that we have a little bit of background about why children might be more vulnerable. So as of early July, over 4 million children have tested positive for COVID-19 since the start of the pandemic. And just under 20,000 new child cases were reported in the first week of July. So these are significant numbers. And the long-term effects, physical, mental, and emotional of COVID-19 infection in children are not yet well understood. So COVID-19 transmission. So SARS-CoV-2, the virus that causes COVID-19, is primarily spread by human-to-human contact transmission via oral and respiratory aerosols and droplets. So an example of this situation of this type of transmission would be a person who's sick with COVID-19 coughs, speaks loudly, yells, sneezes, anything that's going to propel particles from the mouth and nose. Those virus particles spread through the air and people around them can then become infected. Fomite, which is just another word for a contaminated surface. This type of transmission is not a primary source of SARS-CoV-2 transmission. Early in the pandemic, it was thought that this could be a potential source of transmission, a significant source, but we've since learned that really it's that human to human via aerosols and droplets. An example of a fomite transmission would be a person touches a contaminated surface, then immediately touches their eyes, nose, mouth, and potentially becomes infected. But it's also difficult because if they're touching a contaminated surface, they've also likely been in contact or near a person who was sick with COVID-19. So it's kind of hard to parse that out. But really, just to re-emphasize that human-to-human transmission is what we're most concerned about and is the main type of transmission for COVID-19. Children have luckily been not getting as sick with COVID-19 as adults throughout this pandemic, but they can still be infected, as you saw from those numbers. They can still get sick with COVID-19, and they can still spread the virus to others. So most children with COVID-19 have mild symptoms or might not have any at all. However, some children can get severely ill. So what would this look like maybe? Kids can develop a respiratory failure, heart failure, shock, renal failure, or kidney failure, and eventually they can potentially develop a rare but serious condition known as multi-system inflammatory syndrome in children, or MISC, as you may have heard. And the numbers are small for MISC. It's definitely not the definite endpoint of a COVID-19 infection in a child. But I was looking up and just out of curiosity, looking the number of MISC cases in Texas so far. And as of July 5th, 2021, these numbers were 197. And only one of these cases resulted in a fatality, but there are still significant morbidity, so long-term health effects that can occur after this illness. So it's something that we want to be conscious and aware of and trying to prevent. And then severe COVID-19 illness and deaths have been reported in children less than 1 year old, so the youngest, and then also those with underlying health conditions. So there's limited evidence about which specific underlying health conditions in children might increase the risk for severe illness, but current evidence suggests that children who are medically complex with certain genetic, neurologic, metabolic, or congenital heart conditions might be at increased risk for severe illness. And then children with obesity, diabetes, asthma, or other chronic lung disease, sickle cell disease, or those that are immunosuppressed may also be at increased risk for this severe illness. So if you have children of your own or you're involved in taking care of children, which I assume many of you are since you're at this presentation, you know that there are pretty much any symptom can be related to COVID in adults, and it's kind of the same thing with kids. So I have the big long list here of all the symptoms, but it's pretty much anything under the sun. It can mimic your normal viral upper respiratory infection. It can mimic a GI bug. So there are lots of different symptoms that can go along with this, and they can range from mild to severe again, and some children may remain completely asymptomatic. So our focus is prevention. So we want kids to get vaccinated as soon as eligible and available, depending on their age and what's available in their area. Encouraging them and educating them on how to wash their hands properly and using sanitizer when soap and water isn't available. Physical distancing, choosing outdoor over indoor venues still, wearing a mask if not vaccinated, avoid touching the face, especially if you haven't had a chance to wash your hands recently, cleaning and disinfecting when necessary. And again, that's going to be talked about a lot more in one of the sessions after this one. And then following local and state guidance on travel and other restrictions. And something that I mentioned before is that children are more vulnerable because they don't have control over their environment. So as the adults in the room, so to say, we need to model this behavior that we're expecting of our children. So it's really important to model the hand washing and the distancing and wearing a mask and getting vaccinated when available and eligible in adults, so that when the time comes for our children to have these opportunities, then that is kind of the standard or the status quo that's been set. So you might kind of be wondering where COVID-19 and environmental health intersect. So just an example of a situation, let's say there's a parent with a child who has asthma at home. And every time the child gets sick with a viral upper respiratory infection, they have an asthma exacerbation or a flare-up, and they get really sick. So the parent's really worried about their kid getting COVID-19 because they feel like if they get it, they'll probably get really sick like they do with other respiratory infections. So to prevent them from getting sick, they start using a lot of chemical disinfectants around the house to make sure that surfaces are super clean, so that even if they're wearing masks and really mostly staying inside, there's just no chance at all that they are exposed to COVID-19 or SARS-CoV-2. Little do many people know that a lot of these chemical disinfectants and cleaners have a lot of adverse health effects. And one of them is that a lot of them, including bleach and quaternary ammonium compounds, a lot of the wipes that we use in the home setting, are asthmagens, which means that they can either trigger asthma, existing asthma, or they can lead to the development of asthma. So using these disinfectants when not necessary could actually lead to an asthma flare, which is what we were trying to avoid in the first place. So again, from what we know, COVID-19 is not transmitted via surfaces. So that's kind of our goal with a lot of this education and a lot of what Jessica is going to talk about, to educate on when it would be appropriate to use those disinfectants and how we can cut back on our use of them to avoid some of these negative health effects that we may see by using them. And I think Jessica mentioned this last week during the intro session, but we don't want the solution to be worse than the problem. And then you may have noticed that throughout a few of these slides, there have been little comic looking pictures. And Dr. Esther Min, who's on the call with me, she's the co-lead for the Region 10 PASU COVID-19 Safer Disinfection Project. She helped to develop these comic strips for families as a resource. And right now they're available at this link. And here's just a little preview of them. We're also trying to make them available as a coloring book for kids, as well as stickers for kids. So that's something to look out for in the future. And then in summary, children are uniquely vulnerable to environmental health hazards. Although COVID-19 infections are generally not as severe in children, it is possible for them to catch, transmit, and get sick from it. Certain things that people do to prevent the spread of COVID-19, like using chemical disinfectants, can actually pose health risks to children. And the best way to prevent COVID-19 infection in children is vaccination when eligible, wearing a mask, washing our hands, and physical distancing. And that is it for the lecture portion of the presentation. So now I have the case and discussion portion. I'm not sure if we need to take a break or if we should field some questions first.
We can go ahead, and if anyone has any questions on the presentation that Mary Kate just finished giving, please, by all means, you do have the ability to unmute yourself. I did mute a couple of you during the presentation. So please feel free to ask any questions. If you don't want to ask them out loud, you can put them in the chat or in the Q&A. If we have no questions, I'll go ahead and stop the recording and we can move on to the case discussion. Okay, I don't see any questions coming in. I'm going to go ahead and stop the recording, and Mary Kate, you can move on to the case.